sanitize in. Hey, how are you today? Good. My name is Nathan Yoder. I'm a student of physical therapy here at UAMS. Is it okay if I work with you today? Alright, so what I'm going to do is I'm going to go ahead and take this old bandage off. I'm going to clean your wound up a little bit, take some assessments, and I'll go ahead and put a new bandage on there for you. I'm just doing this to make sure that we are getting rid of, any kind of bacteria or infection, and we're going to try to prevent that as much as possible. Before I start, are you in any pain? Okay, good. Well, throughout this whole process, I don't expect you to have any pain, but please let me know if you do, and we can change your positioning or do what we need to do to get you more comfortable. Okay, well, I'm going to go ahead and get my supply area ready, so I'll be with you in just a moment. So I'm going to go ahead and clean my supply area with this clean sterile wipe. Clean it, get the edges nice and clean. Alright. We'll go ahead and throw this away into the trash. We'll go ahead and scoot it forward too, make sure it's in a good spot for me. Throw it away. And I'm going to go ahead and wash my hands. So I'm turning water on, and I'm going to rinse, starting on my elbows. I'm going to get some soap, and I'm going to start scrubbing. Wash them for about 30 seconds. Go ahead and rinse off now, starting at my elbow. Letting the water drip down off my fingers. Okay. We'll go ahead and start drying myself off. Throw that away. I'm going to go ahead and turn the faucet off with a clean towel. I'm going to go ahead and get my area set up. Got this towel over here where I'm going to put my dirty material after I've used them. Okay. I've got my supplies ready. Alright, I'm going to go ahead and put on my PPE now. Make sure I was getting everything. So, go ahead and put on my gown. Go ahead and put some clean gloves on. Okay, how you doing? Good deal. I'm gonna go ahead and put this towel up under you. So I'm just gonna have you roll over. Okay, you can roll back now. Alright, let's go ahead and take a look at this bandage here. So I'm going to go ahead and take it off nice and easy. Make sure I'm peeling away the skin away from the bandage. Let me know if you feel any pain with this. Try to be gentle. Okay. So it looks like we got a minimal amount of serous exudate. It is odorless. That's a good thing. I'm going to go ahead and throw this away. I'm going to go ahead and start cleaning this wound. So get a couple sprays of my saline. Put this over to the side to my designated dirty area. Go ahead and start cleaning this up a bit. Okay. Good. Throw that away. Go ahead and clean the edges now. Dry them off the outside. Okay. So now that my hands are dirty, I'm going to go ahead and take my gloves off, throw them away into the trash. Throw those away, my hands are clean. I'm gonna go ahead and tear my tape now. Okay, I'm gonna go ahead and set my tape off to the side. I'm gonna go ahead and put some clean gloves on. Okay, let's take a look at this wound here. Alright, looks like we got about 80% viable granulation tissue in the wound bed with about 20% slough. Wound edges are attached. There is no depth to this wound. I don't notice any tunneling or undermining. And the peri-wound is unremarkable. So with that being said, I'm going to go ahead and start with some measurements. Okay, so from about 11 to 5, got about 5.9 centimeters. And 9 to 3, that was in length. Now 9 to 3, we have about 5.7 centimeters in width. We'll go ahead and throw this away. I'm going to go ahead and protect the peri-wound now. Okay, throw this away. Alright, I'm going to go ahead and start packing this. Okay. Let's get this in there. Okay. Get my secondary dressing. Okay, we'll go ahead and date and initial this. Okay, set this off to the side as well with my other dirty supplies. I'm gonna go ahead and remove this towel out from under you. So I'm gonna have you lean over. Very good. Okay, I got this towel. You can come back now. We'll go ahead and dispose of this to the dirty laundry. So I just want to remind you of a couple things. Since this is a pressure injury, we want to make sure that we are never ever lying directly onto the wound. This will just further impede its healing. So we want to make sure that we are turning every 2 hours, and we want to make sure that we are staying on a well-nourished diet. So eating those protein-rich foods. That way we can, promote that healing in this wound. So I'm gonna go ahead and make sure that my supply area is clean by throwing away anything that I may have contaminated or that I'm not going to use. So I'm going to throw away these materials here. That way I can go ahead and dispose of this towel into the dirty laundry. And now I'm going to go ahead and take off my PPE. And I'm going to throw these in the PPE dirty laundry here. Okay. I'll toss those, take off my glasses. I'm now going to use a clean alcohol wipe to grab my pen. Make sure I'm not contaminating it by touching it. Okay, put that in my pocket, throw that away. Go ahead and grab another alcohol wipe and wipe off the squirt bottle. And I'm just gonna go ahead and put this in your room so that we know to use it next time. And I'm gonna throw this away. Go ahead and get another one for this tape. I'm gonna put this tape up here too, so that we know where it is. And I'm gonna go ahead and grab this towel with my wipe, throw it into the dirty laundry, and I'm gonna throw this away. So I'm now gonna go ahead and wash my hands. So turn the water on, start rinsing at the elbows. Here, okay, get some soap, start scrubbing up to my forearms. Okay, getting under my nails, getting the palms nice and good, getting the backs of my hands, in between my fingers. Okay. Go ahead and start washing off, starting at the elbows. And the water rinse off my fingers. Okay. I'm going to go ahead and get a paper towel now to dry myself off. Throw this away. Go ahead and grab this paper towel so I can turn off the faucet. Throw that away. Well, okay, that is it for me today. Do you have any questions before I go? Okay, well, if you need to reach out to me, let the nursing staff know. They know how to get a hold of me. And I'll also be popping in and out, just checking on you, make sure everything's okay, see if you need anything. All right? Well, we'll see you next time. I'm going to go ahead and hand sanitize my way out.